LP little a shows great promise in reducing heart attacks. But hey, Dr. Levine, what's the real story? I'll tell you the real story. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my posts, please like, share, and follow. Newsflash from Eli Lilly: lipodiceran reduced levels of that genetically inherited risk factor, the LP little a, by nearly 94%. Wow! At the highest tested dose in adults with elevated levels. In a phase 2 alpaca trial, lipodiceran significantly reduced levels of genetically inherited cardiovascular risk factor, with some patients sustaining reductions for a year and a half. And this data was presented at the American College of Cardiology and simultaneously published in the most important journal, the New England Journal of Medicine. It's huge news. So what else? Let's talk about LP little a. Look, it's an atherogenic small particle found in the blood that is associated with an increased risk of heart attacks, right? So what do we want to do? We want to lower it. Now it appears that elevated LP little a risk is similar to elevated LDL cholesterol, the other bad one, but actually potentially less risk, which was shown in the Women's Health Initiative trial, than an inflammatory marker, high sensitivity CRP. Now, doctors have known about LP little a for how long? For decades. But only recently was this circulated in the news. Now we all know about it. Now why is that? In my opinion, because big pharma, well, they ran out of what they can do to use to lower the LDL and increase learnings. They needed to concentrate on something else. Nothing wrong with that. We live in a capitalist society. They need to make money, make a good product. But how about something else they did? What about looking to raise the good cholesterol with a medication first? The good cholesterol, that HDL. The answer is, they did. You may not be aware of this, but pharma had a similar phase 2 trial, the type of trial that looks just like alpaca, to see if a drug works the way it should and raise that good HDL before going on to a trial to see if raising HDL helps outcome. It's called a phase 3 trial, and you need that trial done, and it must be successful before the FDA gives an okay to sell the drug. And guess what? Again, just like that phase 2 trial, the alpaca in LP little a, the phase 2 trial on raising HDL, gangbusters with a drug called torcetrapib. It was really positive. And well, again, lots of high fives went around and said, whoo, bingo, we got to go off to the phase 3 trial. And they did. Pfizer sponsored a huge 15,000 patient trial, half getting placebo and half getting the drug that we know raised HDL. Results? Well, we may never have the full results. The trial was stopped before its end. Why? To prevent more people from dying. 82 patients dead who got the drug, 51 patients dead who got the placebo, 31 extra people dead, or a 61% increase in death. And that's why you never heard of these drugs. Then there's the trials on vitamin D. Yup, we know it. Low vitamin D is associated with a higher risk of heart disease, including high blood pressure and heart failure and heart attacks. And here comes this trial. Makes sense to show that giving vitamin D, raising the levels to people with low vitamin D, will reduce the risk of heart attack. But don't fool with Mother Nature. Whether you're raising vitamin D or making margarine, it's very complicated, and the trial is an absolute bust. They raised it, but no benefit even in high doses of vitamin D in a large randomized trial. No change in heart attacks, strokes, or deaths from heart disease. Got it? So now, after we all high five over this phase 3 trial that's set on lipodiceran, you begin to see commercials looking for patients to be part of the study. They look for the highest risk patients first to get the greatest chance for benefit. Those who've had heart disease or a risk of having it or elevated LP little a. Got it? Remember, why they don't tell you this. You now know how the drug works, right? really well. It lowers that LP little a. Wow, it's powerful. But what we don't know, if lowering the LPA helps people or harms people. Now all those high fives that are being given, I must say, for a very remarkable lowering in the phase 2 trial alpaca using lipodisirin, maybe it's a little bit too premature. What are your thoughts?